Hi class, my name is Darlena and this is a presentation on my Capstone project. The topic of my capstone is the utilization of predictive modeling in California's pulmonary health data. Some background on my capstone include the use of predictive data modeling, which is the statistical process of analyzing trends in data to predict outcomes or future events. Predictive data modeling can be applied to managing population health issues. For example, California's population health concern includes respiratory illness such as chronic obstructive pulmonary disease and lung cancer. According to the ALA, California is ranked third in the nation for highest rate of lung cancers, and this could be attributed to factors such as poor air quality and air pollutants. My approach to this project includes using a predictive data analysis model curated by a healthcare informatics professional, which include the design of measurement instruments, interpretation of results, and application of interventions. Measurement instruments include data sources from associations like the American Lung Association, the CDC, and San Diego's HHSA. Variables of interest, which is the focal point of intended outcomes, is California's COPD rate. Predictive variables, which impact the variable of interest, include geolocation, air pollutant exposure, and smoking rates. Interpretation of these results include exploratory clustering methods, which identify trends in data. The results proved a correlation between location and COPD rates. For example, rural communities in California identified as high-risk groups. Interpretation of results include data points, which use a random sample of northern and southern rural and urban regions to compare data. The analysis identified a trend of higher rates of COPD amongst California rural populations versus urban populations. The purpose of using predictive modeling is to predict vulnerable populations to health concern and provide evidence for resolutions, such as the high-risk group identified as rural subpopulation. Predictive variables can also impact COPD risk, such as smoking rate, radon exposure, and air pollution levels. Lastly, of the model, application of interventions, which include identified variables such as increasing access to care, lowering smoking rates, and decreasing pollutant exposure. Other outcomes include high costs associated with COPD risk in population. So by increasing care, access, lower costs associated with high COPD rates. The predictive model, predictive vulnerability amongst California's rural subpopulations, which allows stakeholders to have a focus group when decision making for population health issues. Some study limitations include the accuracy of data collected, as well as ethical concerns to combat limitations. Data was only used from validated sources, as well as de-identified data to ensure privacy, and the access was granted. Next steps and opportunities include future research to predict the correlation rates between predictive variables and COPD rates, such as which predictive variables have more impact on COPD rate risk, such as location or air quality. This evidence provides focus areas for population health management decisions. Some examples include increasing healthcare access to vulnerable communities and increasing anti-smoking to lower smoking rates. The predictive modeling supports population health and improve healthcare outcomes by providing evidence needed for informed decision making. Resolving limitations to predictive modeling include advocacy for data collection and proper use.